Hi, I'm Dr. LeRoy. I've been performing breast thermography as part of my practice for almost 20 years. Breast thermography is a non-invasive, no radiation, no compression, adjunctive breast cancer screening tool to get additional information mainly about blood flow. Unlike a mammogram, breast thermography doesn't look at density, it looks at blood flow. And the significance of blood flow is that when there are cells in the breast that are becoming cancerous or malignant, they almost always give off vasoactive chemicals that increase the blood flow and blood perfusion to whatever area of the breast the tumor is developing in. Now, there's also prognostic value to a breast thermogram in that the more abnormal those blood vessel changes, the more excessive the vascular blood flow to an area of the breast, typically the more aggressive the cancer. So in other words, we get some prognostic value from the thermogram. If you have a very abnormal thermogram, it's likely a highly aggressive cancer, and you're probably going to want to treat it more aggressively. If you're not seeing a lot of vascular changes, such as we typically see with non-aggressive cancers like ductal carcinoma in situ, you may not want to do really aggressive therapy. You may just want to opt to have a lumpectomy and perhaps not do radiation or not do chemotherapy. I'm going to demonstrate some different imaging. Unlike some centers, I do the imaging myself. I correlate physical findings with what I'm seeing on the imaging, and I do my report. I want to have as much information as possible when I do my report. So I do it all myself. So this is a very normal thermogram. As you can see here, I normally capture images in black and white, but I convert them into color usually when I send them to patients and to other doctors. But here we can see there's not really a lot of blood vessels. We're seeing a little bit in the upper here, but not a lot in the breasts themselves. Pretty unremarkable. This is a very normal thermogram. This is in a woman who's 34 years old. We're seeing a little bit more blood flow as indicated by the yellow in the upper outer quadrants of both breasts. That's normal. We're going to see more blood flow as we get up near those areas. Now, we contrast to this, we're seeing more vascularity here. We can see on this color image, here's a blood vessel, here's another one, but these are still normal, just a little bit more vascularity. Normal vascular presentation is to start in the upper inner areas of the breast and go down towards the areolae, such as this. So this is still a relatively normal thermogram. What I indicated here is there's a little bit of a hot spot here where there's more blood flow, and that's a little asymmetric. We're not seeing it here on the left side, we're seeing it here on the right. So in this patient, I've been following it, this area for years now, and there's been no change. I'm also demonstrating I do a quantitative analysis so I can pinpoint this specific area and make comparisons to other areas of the breast to determine whether the blood flow is abnormally high or not. Now, this is a woman that's had breast augmentation or implants. Thermography is great for implants. Because there's no compression, you don't run the risk of damaging the implant itself. Again, there's nothing unusual here. We're seeing a few areas, and here I reversed the color imaging, so the yellow is where there's less blood flow, but we're not seeing any unusual blood vessels or blood flow. Now, here we are. This is a woman where there's an infiltrating intraductal carcinoma here in the right breast, and when you look at this front view or this AP image, we can see that there's quite a significant asymmetry. Big hot spot here compared to the left side. There's a little bit of vascularity coming off that area. When we compare that to the left side, we're not seeing that. Again, we're seeing a little bit more blood flow up near the armpits, but that's on both sides and that's normal. The problem is right here. Here's another case of a malignancy where I'm demonstrating a sequential change. The real value in doing thermography is doing serial monitoring. So when I do a baseline, there's certain things that I'm going to see on a baseline that are what I would call are red flags. And if I see those abnormalities, I know that we need to do some additional testing and really get more information. In other cases, we're not going to see a lot of abnormalities, and we're going to do serial monitoring, which means from a baseline, I'll do a 6-month follow-up. And what this is demonstrating here is that this is July of 2010, and then we're looking at January. So we're looking at about 6 months later, roughly. Now I'm making a comparison from these two spots to these two spots here. And you can see it's a little bit lighter through here than it is here. And what I did was I actually made a comparison from that area to that area, which gives me a delta of a certain amount, which here is 1.67. And now here I'm doing the same areas and I'm getting a delta temperature of 2.53. So that means that this area relative to this area has increased in blood flow from 2010 to 6 months later in 2011. This is the sort of creative analysis that a person needs to do to be able to get the most value out of thermography, because sometimes the changes can be very subtle, as what we're seeing here. Now obviously this is a more aggressive cancer. We're looking at the left breast here is on fire. There's a lot of vascularity. The breast is actually a little bit enlarged. That's an infiltrating intraductal carcinoma here. Another infiltrating intraductal carcinoma, we can see here around the left areola. There was actually a small mass, maybe about 1/4 inch, right under the left areola. We can see some vascularity coming to that side. We're seeing it here on this black and white image, but obviously there's a pretty significant difference from right to left here, and we can see on these oblique images the same thing. Here's a very aggressive cancer. This is a triple negative breast cancer in a 31-year-old. This is the sort of cancer that's often missed by mammograms. Mammograms are better at finding dense, non-aggressive types of cancers. It tends to not pick up highly aggressive cancer like triple negative breast cancer very well. As we can see here, this is highly abnormal. There's a great deal of vascularity here in this right breast. And again, we contrast it to what we're seeing on a normal. So here, very big difference, incredible asymmetry, a lot of vascularity. Normal thermogram, we're hardly seeing any vascularity. Symmetry is very good. And normally in somebody like this I would repeat yearly. So again, breast thermography is based on blood flow, not density. Mammograms are based on density, and because of that, it can be confusing. A lot of women have dense breast tissue, and it can make reading a mammogram at times difficult. Thermography, we don't care about density, we don't care about implants, we don't care about whether there's cysts and other densities. We're looking strictly at blood flow. Breast thermography has been approved by the FDA since 1982 to do breast cancer screening, and like I said, I've used it in my practice since 1995 with great success. I have detailed information on my website, which is drnick.net. I have a whole section about the research. There's over 800 studies on breast thermography showing its efficacy and its usefulness. I have sections on here on normal versus abnormal to give an idea of whether there's what normal is as compared to abnormal, and I have some other information on here about cost and thermography preparation and everything. Again, breast thermography, great test, no radiation, can be used on younger women. I recommend to start at the age of 20 actually, and do maybe every 2 to 3 years from 20 to 30. Once a woman turns 30 years of age, we can do yearly screening at that point. Then if we find anything abnormal, we'll do an MRI, do a diagnostic mammogram, ultrasound, whatever we need to do to get additional information to make a proper diagnosis.